The Ebola outbreak in the Democratic Republic of Congo has now become the third largest in recorded history, and according to the World Health Organization, it is spreading faster than any Ebola outbreak the world has ever tracked. 2 months since it was officially declared, more than 2,000 cases have been confirmed. Nearly 800 people are dead. Let's look at how this virus is outrunning containment efforts and why, even now, there is still no approved vaccine or treatment to stop it. It took the previous major Ebola outbreak in DRC back in 2018 and 19 more than 10 months to reach 2,000 confirmed cases. This time, that same threshold was crossed in just 2 months. That is not a small difference. That is a virus moving at nearly 5 times the pace of one of the deadliest outbreaks in recent memory. The epicenter of concern is the province of Ituri, where health officials say transmission is now intense and difficult to contain. But here is what is really worrying epidemiologists. More than 80% of new cases are being found in people who were not on any known contact list. That means health workers are losing track of the chains of transmission. They don't know who is spreading it to whom, which makes it almost impossible to isolate and stop. And there is another troubling pattern. Roughly 2 out of every 3 deaths are happening in communities, among people who never made it to a health facility at all. They are not being treated, not being isolated, and in many cases not even being counted until it is too late.
Yesterday marked 2 months since the government of the DRC declared the epidemic of Ebola. Since then, the outbreak has expanded rapidly. It's now the 3rd largest Ebola outbreak on record, and in the past months it has expanded faster than any previous outbreak. So far, 2,073 cases have been reported with 796 deaths. By comparison, the 2018-2019 Ebola outbreak in DRC took more than 10 months to reach 2,000 confirmed cases. Intense transmission in the province of Ituri remains our biggest concern. More than 80% of new cases are being detected outside known contact lists, showing that transmission chains are still being missed. About 2/3 of deaths are occurring in communities among people who never receive care in a health facility.
That is the WHO's Director General laying out just how serious the containment challenge has become. The second major concern is the one keeping global health officials up at night. Despite everything we know about Ebola, there is still no fully approved vaccine and no officially approved treatment for the disease. That doesn't mean nothing is happening. In fact, several experimental trials have launched just this month. First, a clinical trial testing 2 potential treatments, a monoclonal antibody called MAB-114 and the antiviral drug remdesivir. Second, just this week, the University of Oxford began the first safety trial in Chad OX1 vaccine candidate. And third, DRC's own National Institute for Biomedical Research launched a trial of an antiviral called favipiravir being tested specifically as a post-exposure treatment given to people who have been in contact with confirmed patients but haven't yet shown symptoms.
Together with Africa CDC and other partners, WHO is supporting the government to scale up the response. There is also encouraging progress on vaccines and therapeutics. Earlier this month, we began a clinical trial of 2 treatments, the monoclonal antibody MBP-113 and the antiviral drug remdesivir. On Monday, the first safety trial began of the ChAdOx1 vaccine led by the University of Oxford. And on Tuesday this week, partners led by DRC's National Institute for Biomedical Research launched a trial of the antiviral remdesivir as post-exposure prophylaxis in people who have been in contact with confirmed cases but have not yet developed disease.
3 experimental trials running in parallel all launched within days of each other, it is a sign of how urgently the global health community is racing against this outbreak. But experimental means exactly that. These are not yet proven. For now, doctors on the ground are still fighting this outbreak largely with the basics: early diagnosis, isolation, and supportive care. Now, despite the grim numbers, there is a genuine silver lining. 377 people have recovered from Ebola in this outbreak. And remember, that is without any approved vaccine or treatment. Doctors say it is proof that when patients are diagnosed early and given safe supportive care, this disease can be survived and outbreaks like this one can be stopped. On the response side, the WHO says it is working closely with Africa CDC and other international partners to help the Congolese government scale up efforts on the ground. More health workers, more contact tracing, more treatment centers, particularly in the hardest hit areas like Ituri.
Even without approved vaccines and treatments, 377 people have recovered, showing that with early diagnosis and safe care, this disease can be survived and stopped.